All right. I'd like to introduce myself. I'm Dr. Ann Helmus, and I'm the director of NESCA. And it's hard to believe that NESCA is coming up on its 20th year. And prior to NESCA, I was the director of another practice for 10 years. So I've been in this space for 30 years of offering private neuropsych evaluations. And I wanted to talk with you this evening about what a neuropsych evaluation is and how to choose a quality provider for neuropsych evaluation. So NESCA has four offices in New England, and this past September we just opened an office in Miami, which has been a real adventure. And in addition to neuropsych practices, or neuropsych evaluations, I'm sorry, we also offer a number of other services, including transition planning for after high school, occupational therapy, speech language, coaching for executive functioning skills and community-based skills. We do a lot of teacher training, school consultation, that kind of thing. So let's dive right in and talk about what is a neuropsychological evaluation. And I think a way to sort of think about it is that an analogy would be when you're thinking about buying a house, you have a home inspector come in, and the home inspector looks at all aspects of the house and advises you about the structural integrity of the house, the plumbing, the heating, the roof, everything, and provides a detailed report so that you can understand what you're getting in that house. And sort of similarly, what we do in a neuropsych evaluation, which I'll go into more, is that we try to evaluate all of the areas of kids' functioning that impact their academic success and their social success so that we can understand what their strengths and weaknesses are. And then that can usually be used to answer whatever the referral question is coming from a parent or from a school about why is a child struggling. And so I want to give an example so that you can sort of understand this. So one really common reason why we see kids for neuropsych evaluations is that they have difficulty paying attention. And I think a lot of people immediately jump to the conclusion that if a child has difficulty paying attention, then maybe they have ADHD. And actually, there's many, many reasons why kids could be having difficulty paying attention. One is that they could have neurologic dysfunction and that they have ADHD, and they may well be helped by a medication like Ritalin. Another reason is that they have sensory problems. Kids who either don't hear well or don't see well often struggle to pay attention. Kids with emotional issues, kids who have depression or anxiety, often have difficulty paying attention and are distractible. Kids who are experiencing a high level of stress, either at home with things that are going on, maybe they have a sibling with severe special needs, parents aren't getting along, or they're paired with a teacher who they're scared of or that they feel doesn't like them. Kids who are intellectually gifted or kids who are below average cognitively will show attentional problems in the classroom. Kids who have postural instability, so that it's hard for them to sit in a chair, will squirm around a lot and have difficulty paying attention. Kids who have language processing issues, because they can't take in what's being said easily, they'll start zoning out and not paying attention. Kids who don't process at the pace of others, and so on and so forth. These are all, whoops, sorry about that. These are all possible reasons that a child might present with difficulty paying attention. And so then the question is, well, how do we figure out what is underlying the child's attentional problems? Because clearly, depending on which of these issues are at play, there's going to be a different set of recommendations and a different treatment plan for that child. So this is where a neuropsychological evaluation comes in. And I think one common misconception that people have about neuropsychological evaluations is that, oh, it's testing. You bring your child in for testing in the way that you went to get a COVID test to find out if you had COVID. And a neuropsych evaluation does involve testing for sure. But really, I like to think of it as having three major sources of information. And those sources of information are history, observations, and testing. And in different children, different parts of these sources of information become important. So, for example, we see some very young children who have autism where testing is really difficult to undertake with them, and the results may not be that reliable. And so we rely very heavily on clinical observations of the child, and history that's reported by the parents, by the teacher, and so on to come up with our conclusions. In other kids, testing is the main thing. So, for example, a child who's gifted, the testing is what's going to show us that they're functioning way above their peers cognitively and academically, and the observations in history may be less important. So, those three sources of information, history, observations, and testing, are used for us to be able to assess all of these different areas of functioning. And so cognitive functioning is sort of overall, what are the child's abilities to reason, abstract thinking, pattern recognition, base of knowledge, vocabulary, and so on. Academic achievement is basically reading, writing, math skills, language processing, visual spatial, all of these areas are going to be assessed and not just with testing. So, for example, we may do academic testing on a child, find out where their reading skills are, where their math skills are, and so on. But we also want to understand their academic achievement based on what the teacher is saying. And so the teacher will fill out questionnaires, and we're looking to see, does our testing and the teacher report, do they match? Or do we find that this child is a great reader, great math skills, and the teacher says they're not performing in school well at all? That helps us start figuring out something's getting in the way. This child has the ability, and yet it's not showing up in school. So we're always trying to integrate history, observations, and testing data. It's not just based on the testing. I should have mentioned this at the beginning. I'm going to go through in the first part of this what a neuropsych evaluation is so that you understand. And then I'll stop and see if there's any questions. And then we'll talk about sort of what makes a quality evaluation and how you can choose where to have your evaluation done. So the evaluation process first involves the review of records. And so this is kind of the part of the history part, which is that when we see children at NESCA, we first have parents send any previous testing that's been done at school or by another evaluator. If the child's on an IEP, please send that in. And then we have standardized questionnaires that parents fill out, teachers fill out, and we're happy to look at work samples. If the concern is about writing, then samples of the child's writing is really helpful. And then once we have all of these records to be able to review, a parent interview is set up. And that's done through Zoom most of the time. And it's about an hour long. And at that time, we'll have parents talk about what their major concerns are, what the history of these issues are, developmental history, and so on, so that we really get an understanding of how we landed in the place that we are right now. And then the child is tested in person, and the testing takes about 5 to 6 hours. We usually break it down into two separate days because we find that for a lot of kids, 5 or 6 hours of testing in one day is really tiring. And so we don't know if we're getting great results in the afternoon. And it's also great to see a child over 2 different days. Sometimes a child will come in and they're not having the best day, or they're angry that they had to be taken out of camp or something like that. And so it's good to see them in more than one occasion. And then when the testing is done and we have all of the results, then a parent feedback session is set up, and that's 90 minutes. And again, it's on Zoom. And at that point, it is not just sort of a presentation of scores. And for some of you who may have been to team meetings where you hear people say, and then I gave a vocabulary test and they scored this amount and it was at that percentile. That's not really what we're doing at the feedback. At the feedback, what we're trying to do with you is to explain, this is what we found about your child, and this explains what the concern is, why your child is doing this thing or not making progress or whatever it is that you're concerned about, a teacher's concerned about. And then we'll talk about what the treatment options and recommendations are, and think about both what needs to happen at home, what are the parenting strategies for you to think about, and what needs to happen in school. And how can we make sure that we get everybody on the same page so that this child is getting kind of a consistent message. Also, for adolescents, usually children over the age of 13, we will often do a feedback with the adolescent and sit down and kind of explain in a very strengths-based way We did this whole evaluation, and what we figured out is that you're really smart and you're especially great at um, things that you can see, visual spatial type tasks. But where you got tripped up was here, and we think this is what's going on, and here's what I've been talking with your parents about. And, trying to really get them on board. Because if they don't understand what's going on and why we're making the recommendation, they're not likely to participate in it. Um, So I want to just give sort of a quick case study so you can see what I mean by history, observations, and testing and how they all kind of come together. And so this is an actual case that was referred to NESCA of a 12-year-old girl. And this was a young woman who had long-standing anxiety issues that were probably never really addressed and had increasing problems getting along with her peers. And so by middle school, the problems with socialization had become so significant that they sought out an evaluation, and their question was, does she have autism? And we just missed it. And I think somebody else had seen her and said that she was probably autistic. So the key things that I pulled out of the history are that she had difficulty with nursing. She had her early social skills development was normal, according to the parents. She had articulation problems. She was slow to learn how to read, and she got special ed support for reading and writing. And she had celiac disease. And I'll tell you why I pulled these things out and why I thought they were important. So, kids who have difficulty with nursing, um, the problem is that they don't have good control of their oromotor skills, which is that when you think about what nursing takes, you've got to coordinate your lips, your tongue, the suck reflex, all of that together. And neurologically, some kids have difficulty with that. Those same kids often have articulation problems. They have speech impediments because it's the same problem. They don't have good oromotor control. They're not good at coordinating lips, tongue, breath, all of that. So that was the first thing that I was thinking about. The second thing is that the fact that early social skills were normal suggests to me that it's probably not autism, because usually kids who have autism, there have been social skills problems all the way through. And then the fact that she needed special ed support for reading and writing said to me, something could be going on in the language system, because she had difficulty with speech when she was very young, difficulty with nursing, and then when she got into kindergarten and first grade, written language was difficult for her. So here's the observation section. The teacher painted a picture of a child who holds back, quiet, doesn't engage with others, and doesn't communicate effectively. The parents indicated she can't form friendships, she picks at her skin, doesn't sleep, and has certain rituals that she has to line up all the stuffed animals in a certain order before she goes to sleep. And if somebody interrupts that, then she has to start all over again. And during the evaluation, I found that she was quiet, that she had some speech issues, which is unusual at 12, that she struggled to express ideas effectively, and that she did not socialize. And at NESCA, in the evaluations, we try to engage the kids socially between tasks, during the break, that kind of thing, because it's one way to observe their social skills. How easily do they converse? Do they pick up on nonverbal cues? Do they understand when we're being gently sarcastic? Things like that. And she was hard to engage. So, what the test results showed is that when I gave her visually based tests, things that she could see, she scored in the superior range, way above average. She did a great job on anything that was puzzles, blocks, anything she could see and maneuver. But when we were having verbal tests where I was asking her questions verbally and asking her to explain things verbally, she really struggled. Um, she couldn't follow oral directions well or answer complex questions. We have one test where they just have to repeat sentences of increasing length. She struggled to do that. There was another task that was a visual motor task that she did a really good job on. And then part of the task is explain to me how you got that answer. How did you know it had to be this and not that? And she would just shrug and say, I just knew that was just the right answer. She couldn't explain, well, I knew it couldn't be this because of that, and so on. She couldn't articulate that. And we have parents and teachers fill out questionnaires where they rate the frequency of symptoms, and then we look to see where that places the child relative to their peers for different kinds of things like depression, anxiety, attentional issues, and so on. And she had clinically significant levels of anxiety, both at home and school, meaning that she has more anxiety than 98% of peers at home or at school. So the diagnostic formulation for her was not that she had autism. Putting all of this together, the history, the observations, and the testing, I said she has a communication disorder. She struggles to convey her thoughts in words, and this is really common in kids who have had early articulation issues. Um, she has receptive language issues, so she struggles when people are talking to her to take everything in at the rate that we would expect. And so in the lower grades, she could sort of get by. But as she moved into middle school, the language demands became much more complex, both in the classroom and socially. And she started struggling more and more because of these weak communication skills. I also diagnosed her with a social anxiety disorder. And what a social anxiety disorder is an anxiety triggered by certain types of social situations. And so when I say certain types, what I mean is that for some children, they only will become anxious in the presence of adults, or they will only become anxious in the presence of peers, or only with males, or only with females or whatever. And what happens is that in that situation, they sort of go into fight, flight, or freeze mode. And in her case, she would just freeze. It was hard for her. She wouldn't engage. She wouldn't say anything. She would just become so anxious. And I think that where the social anxiety disorder came from, it happens a lot in kids who've been bullied, for example, which makes a lot of sense. You know, if you've been picked on by your peers, that you might become anxious with peers. In her case, um, what we see is that kids who have articulation issues have difficulty expressing themselves to people, and listeners are often saying, "Wait, what? Sorry, can you repeat that? Say that again. I didn't get that." And so, they feel like they're not making a good connection, and that feels frustrating and makes them anxious. And now, she's gotten older. She doesn't communicate very effectively, and so she gets frustrated. The listener gets frustrated. She gets easily overwhelmed if there's too much language input. And then I think also managing the celiac disease and being the kid at the birthday party that can't eat cake, and worrying about if something has gluten in it, that sort of makes her feel different. And I think all of those things contributed to her becoming really anxious in social situations. Um, And we see this a lot, kids who have communication issues and anxiety. And it becomes sort of a vicious cycle where when she's presented with a lot of language demand, she becomes anxious. And the more anxious she is, the harder it is for her to compensate for the communication skills. And then that makes her feel more anxious. And so it sort of goes around and around and around. Um, and I think I forgot to put in the recommendation slide. So the recommendations that I gave to this family and to the school had to do with her getting speech language therapy to address the communication issue, working with a psychotherapist on the anxiety piece. We also recommended to see a psychiatrist and get some medication on a temporary basis to reduce her level of anxiety so that she could engage with all of this therapy. And the last I heard, she was doing pretty well as a result of all of this. I'm going to stop there for just a second and see. Let me see if I can. If you have any questions, if you want to put them in the chat or the Q&A. All right, looks like there's no questions, so I'm going to keep on going. We can do questions at the end. Um, so at NESCA, we see a lot of parents who've gotten evaluations in other practices or hospitals or school, and we see some evaluations that are really well done, and we see some evaluations that aren't so well done. And so I think that that's one really important thing that I want to get across is that um, unlike a COVID test, where probably no matter where you go get a COVID test, somebody can administer it properly, and you're going to get the same results. You either have COVID or you don't. Um, with the neuropsych evaluation, it can be done incorrectly. And it's an enormous investment of time and money and energy. And so why is it important to do it right the first time? So what the things that we see that go wrong are that there's an incorrect formulation of the child's profile or the child's diagnosis. And so, for example, in the case that I just gave you, it would be very easy for somebody to make a diagnosis of autism in that circumstance and just say, well, she doesn't get along socially, she's quiet, she has language issues, and this young woman did not need treatment for autism. And we've seen many situations where the profile is wrong or the diagnosis is wrong, and so the child gets a treatment plan that either is ineffective or it's harmful for a child. I worked with a family last year where the child had been incorrectly diagnosed with autism, put in a program for kids with autism, and he didn't have autism. And he was not only not making progress in the program, but he was sort of, feeling worse and worse about school because he was having a hard time making friends with the other kids who were in the program. So things like this happen. I'm noticing that there's a couple questions here. Let me just see. Um, Let's see. Is there a difference for adult evaluations and have you teased out with nursing problems? Um, so the person who asked, is there a difference for adult evaluations? If you'll just type in, I'm not sure what the question is, difference between what? If you are you, yeah, just if you could clarify the question. And then the second question is, have you teased out with nursing problems whether those problems were subsequently resolved? For example, tethered oral issues that have been addressed in infancy, no longer an issue. Um, yeah, I think it depends on what the reason is for the nursing problem. So if it's a mechanical issue like tethered tongue and they get surgery, then I think that's a different story. But if there's a neurologically based issue that they can't coordinate lips, mouth, tongue, suck reflex, breath, all of that, then I think that's not as easily resolved. Um, All right. So, another thing that we often hear about with reports is that the family went through the whole evaluation and the recommendations just were disregarded by the school team. And so, a lot of times, school teams aren't thrilled with recommendations that come from independent evaluators because a lot of times those recommendations may cost them money or they may have to do something. Um, but there's sort of two types. There are situations where a school team admits that, the evaluation was well done. They understand the recommendations. The recommendations follow from the evaluation, but they just disagree with them, or they think that they're already doing them, or whatever. There are other situations where the school just says, this is not a good evaluation. The recommendations don't make any sense. The diagnosis doesn't make any sense, and we're just disregarding the entire thing. And and that's a difficult situation to be in. And sometimes we see these cases go on to hearing, and sometimes the hearing officers will say the same thing, that this is not a quality evaluation, and they're not going to follow the recommendations. Um, we see situations where there are recommendations that are unusable by the teacher. And the reason why they're unusable by the teacher is because there's 5 pages of recommendations, and the teacher is just like, what am I supposed to do with this? I can't do 5 pages of special things for this one kid. Um, or the recommendations don't fit with how the classroom is set up, how the classroom is run, what the teacher does, so on and so forth. They're just not well thought out. They may be just sort of generic recommendations that are made for any kid with a learning disability. Um, there are many neuropsych evaluators who do not do school observations or attend school meetings. And that can be a real problem because many times, if the report is just sent into the school, particularly if the evaluator is recommending something that might be difficult for the school to do, like the child needs to be in a language-based class, or they need an aide in the classroom, or they need, 40 hours of ABA every week or something like that, the school will push back on that evaluation. And if the evaluator is there, then it's much harder for the school to push back. And one thing that parents need to understand is that in the legal process, schools do not have to do what an independent evaluator says, but they do have to consider the evaluation. And so if you get an independent neuropsych evaluation, the school is required to hold a meeting to discuss what the results of the evaluation are and to discuss whether it changes the child's ed plan or not. And oftentimes, again, particularly if you're asking for something high stakes, having the evaluator there will make that meeting go much more smoothly. And in situations where there is a dispute between the family and the school, having an evaluator who can go in and observe the child in school or observe the program that the school is proposing for the child can make all the difference in the service delivery. And so, when we talk about quality evaluations, part of it is that the evaluator needs to be able to go beyond just doing the testing, doing the feedback, and giving you the report, but making sure that the recommendations are implemented in the school. Otherwise, it's not going to help the child. Um, and I think also that when you go for a neuropsychological evaluation, many times you're going to be referred to other professionals. Your child needs OT, your child needs speech language, your child needs psychotherapy, they need a psychiatrist. And you don't want to be referred to professionals who it's like, oh, this person belongs to my tennis club, and I'm sure they're a pretty good psychiatrist. You want to be referred to people who have been sort of vetted by a practice. And so at NESCA, we have a number of people that we often refer to because we have a lot of experience with them. And also, probably a day doesn't go by where there are not emails that are being sent out where people are saying, does anybody know a speech language pathologist that's near Medfield that works with kids with autism, or something like that. And so then they have 14 other neuropsychologists contributing referrals that they use. I'm going to stop for 1 second. Seems like there's more questions. Um, let's see. Okay, so the question was, is there different for adult evaluations? Meaning, do you do the same types of testing and gathering of history for adults, someone in their 20s, when evaluating for autism and or anxiety? The answer is yes, absolutely. And that's a great question. And so we do a lot of work with young adults in their 20s. And these are typically the questions that we're evaluating for autism, anxiety, or ADHD. Um, let's see. Then I'm curious about when a child's behavior is the barrier in school and child has ADHD, but all other school testing shows up as average. What can a neuropsychological evaluation show in this regard to support behavior? Um, and so I think that that we would definitely do more testing than what the school does, and we would get more information and integrate it and be able to talk about just because the school test scores are average doesn't mean that the child is not eligible for a 504 or for an IEP and to get support. And so it's a great question because this is often the difference between a school-based evaluation and a neuropsych evaluation, or one of the many differences, is that school evaluations tend to rely very heavily on testing. They just give, batteries of academic tests or speech language battery or whatever it is. And if all the scores read average, then they say everything's fine. We didn't find any problems. And at NESCA, like I said, we're using history, observations, and we have many more testing instruments that we're using. And so, if the school has a bias, their bias is to find that there aren't any problems. Because by law, if they find a problem, then they have to accommodate it or fix it. Our our bias or our approach is okay, the parents are reporting that there's something going on. We need to understand why they're reporting this. We need to figure out what what is the behavioral problem the child is having? Why are they having it? How is it getting in the way? What do we need to do to support this child? So we're coming at it with sort of a different question. Does NESCA accept the state rate for neuropsychological evaluations and IEs? We do not accept the state rate, but many school districts will contract with us to do evaluations for our full rate. Um, and this is particularly true with cases that have been complex or difficult where they feel like, okay, we've tried and we're not coming up with the right answer. And I think because NESCA has a very strong reputation that many schools will pay the full rate with us. And so you can ask them that. Um, And I'll talk at the end a little bit about paying for a neuropsych evaluation and the financial aspect. Um, so one thing that is important is that there are some people out there who call themselves pediatric neuropsychologists or say that they're doing neuropsychological evaluations when they aren't actually trained as pediatric neuropsychologists. And so to be a pediatric neuropsychologist, you have to be a doctoral level psychologist. So you have to have one of these degrees. And I'm often asked if one of these degrees is better than the other, and the answer is no. They're coming from slightly different um, graduate type programs, but these are all, 4-year graduate programs. But here's the most critical piece is that the person needs to have 2 years of supervised postdoctoral training in pediatric neuropsychology. And this is something, in a minute, I'll show you sort of questions that you can ask when you're considering a practice. And this is one of them. The person who's seeing me, have they had 2 years of supervised postdoctoral training in pediatric neuropsychology? And what we don't want to hear is, oh, this person shadowed a private neuropsychologist for 6 months, or this person has had some training, or this person had 1 year of postdoc, or they did lifespan neuropsychology, which means that they spent a certain part of their postdoc training with geriatric patients, and which is a completely different branch of neuropsychology. And so this it's really important that they've had supervised postdoctoral training. So as I mentioned, for 30 years, I've been running private practices in Boston. And over that time, I've made some really great hires and I've made some really terrible hires. And so I've spent time sort of reflecting on, who are the people that are really good neuropsychologists? What are the qualities that they have? And, what are the qualities of people who aren't really great neuropsychologists? And what I realized is that there's sort of three pillars that I look for when I'm interviewing somebody. And if we had a 10-point scale, I would say that they have to be, for them to be successful at NESCA, they have to be at least an 8 on all of these pillars. And my hiring mistakes in the past have been somebody who's a 10 on one pillar and a 4 on another pillar. And even if it averaged out to 8, it doesn't work. They have to be at least an 8 on all of the pillars. And so what are those pillars? The first is interpersonal. Um, You've got to have somebody who can build rapport with a teenager who won't speak to them, with a 5-year-old who's destroying their office. Whoever walks in the door, they've got to be able to build rapport and understand that child. They've got to be able quickly to build a relationship of trust with the parents, to listen well, to understand where the parents are coming from, to be empathic and respectful. And they've got to be able to negotiate with the school team and to come in and to realize that, schools are under a lot of pressure. Many schools are doing the best that they can, and they still need to meet the needs of this kid. And so, how can we, be sympathetic with what's going on with them and also advocate for the child who we've evaluated to make sure that they're getting their needs met? The second pillar would be sort of analytic. What you see with the neuropsych evaluation is that there is an enormous amount of data. You've got all this history of all these observations from yourself, the parents, the teachers, and then you've got all of this test data. And so you have to be able to integrate all of that information and decide what's important and sort of constantly toggle back and forth between what's the big picture of what's going on here and what's this small detail that is so incredibly important. And to go beyond the test scores, to really think about what do those test scores mean in this particular kid, not just at face value. And then the third pillar is communication, which is that you've got to be able to present the test results to parents and to the school team in a way that people understand and that's meaningful for them. And that you're using examples that they can latch on to and say, I get it, you're right, that makes sense. When he's doing this, it's because he's anxious, not because he's oppositional. And then those same results have to be communicated in writing, again, in a way that everybody can understand and can use them. And I think that one of the mistakes that I see in a lot of neuropsych evaluations is that they're too long, that people just write everything that they think about this child, and that's not helpful. You need to be able to get to the essence of what needs to be in this report and why. Who am I writing for? What am I trying to accomplish here? And that is a good report. So these are the things that I look for in a high quality evaluator. And again, it sort of goes to the idea that not all evaluations are created equal. Um, and this is sort of just repeating this, that can they interpret the test scores? Can they make recommendations that are specific to the needs and the resources of the child and the family and the school? And then can they assist in the implementation of recommendations and work with other professionals effectively? Um, so in the Boston area and New England in general, there are a lot of private practices. There's group practices, there's solo practices, and then we are lucky enough to have some of the best hospitals in the country. And many of those hospitals, such as Mass General, Children's, Tufts, have also neuropsychology programs. And so the hospital-based practices have the advantage of they will accept almost every insurance, including Mass Health. And so that is a tremendous advantage if you're relying on insurance payment. A disadvantage of the hospital-based setting is that their waiting lists exceed a year now, and in some places are getting closer to 18 months. Um, and that's a long time to wait if you're worried that your child has autism or something like that. The other sort of relative disadvantage, I would say, of hospital practices, and I've worked in both. I started my career at Children's Hospital and absolutely loved it. Um, is that the hospital-based practices are a little bit more oriented toward the medical model and towards working with the other doctors in the hospital and less oriented towards interfacing with schools. And so it's rare for neuropsychologists in hospital-based settings, for example, to attend team meetings, to do school observations, to participate in a special ed hearing, that sort of thing. Then, another sort of consideration I think to think about is going to a solo practitioner, or, one or two people in a group versus a diversified group like NESCA has about 15 neuropsychologists across the different sites. And the advantage of the group practice is that at NESCA we have neuropsychologists that specialize in different areas. So we have some that are really experienced in working with kids on the autism spectrum. We have some that are really experienced with working with adolescents, some that primarily do learning disabilities. And so when a parent calls, they can be matched with the doctor that best meets their child's needs. And that doctor has a really deep level of experience with local programs, local referrals, that kind of thing in that area of autism or learning disabilities or emotional issues or whatever the thing may be. When you go to a solo practitioner, the solo practitioner is probably not going to be equally good in all areas. My experience is that most neuropsychologists have areas, types of evaluations that they like better than others, types that they're better at than others. And so if you are in the sweet spot of that practitioner, it's great. If they're a practitioner that's trained in autism, they love seeing kids on the autism spectrum, your child is autistic, you're going to be in good shape. If your child has a complex learning disorder and this person is primarily trained in autism, you're not going to get as nuanced of an evaluation. And so that can be one, sort of disadvantage. So questions to ask, and we'll make these slides available after the presentation, are, how many years of experience does a person have as a pediatric neuropsychologist? And I would be counting years postdoc. So, if they finished their postdoc last year, then they've had 1 year of experience. And it's not necessarily a bad thing, but I would be more comfortable with a young neuropsychologist if they were in a group. So, and it's a group where they can get support. So, for example, at NESCA, we have 3 clinical directors, and so all neuropsychologists there, whether they're younger or more experienced, know that if they have questions about diagnosis, about recommendations, they should go to one of the clinical directors. We also have case conference every week. And at that case conference, ahead of time, doctors send the score sheets and what their question is, and then the whole group discusses whatever their question is about diagnosis or recommendations. And so in that sort of setting, a young neuropsychologist can do a fantastic job. A young neuropsychologist solo, they're just going to have less experience in terms of making recommendations. Um, And I would ask specifically about the experience and expertise with this diagnosis or with this age group. Do you have expertise in autism or in learning disabilities or working with preschoolers or whatever it is? Um, if you are going to be needing something from your school, you should find out, do you have experience going to team meetings, reviewing IEPs, due processes when you have to go in front of the Board of Special Ed Appeals? Are you available to participate in this? And find that out before you get started. Um, what is your ongoing professional development? In Massachusetts, well, everywhere, all neuropsychologists have to get continuing education units. So that goes without saying that they're getting however many units they need to get. But what about where they work? So hospital-based practice is great because there's case conference, there's seminars, there's all kinds of learning opportunities in academic medicine settings. But in private practice, do you have supervision? Do you have mentoring? Is there any accountability here? How many cases do you do a month? And this is really interesting. I hired somebody who came from a hospital, and she had to do 10 to 12 cases a month, 10 to 12 full evaluations a month. And she said to me, Anne, when you're doing that many cases, you don't even have time to think. You're just writing. You're just testing and writing, trying to keep up with the constant demand of getting the reports out. And at NESCA, all of the doctors, one doctor does 7 cases a month, a few do 6 cases a month, and many do 4 cases a month. And we keep it that way so that the doctors have time to think. They have time for collateral contacts. They have time to do whatever needs to be done. They're available to go to a team meeting. Their schedules are not packed because we're trying to take really good care of the kids that do come in. And then you want to find out what is the financial aspect. Do they accept insurance? Are there payment plans? And so on. And so, just to answer that question for NESCA, at NESCA, we accept Blue Cross Blue Shield, and we also accept United Behavioral Health Plans. Um, we have a credit card that you can apply to online. They send you the link in the appointment letter. And what that credit card does, it's put out by Discover, is it allows you to pay for the neuropsych evaluation over, I believe it's 16 months at no interest. And so it's, essentially a payment plan to break the payments down into 16 payments. We also have a thing on our website that allows you to access your HSA or your FSA, and it's all automated. And so it will, you fill in the information and then it spits out your authorization letter if you need it. It shows you how to access the HSA or the FSA. It shows you how much the equivalent cost is in pre-tax dollars versus post-tax dollars, all of that. So we've done, what everything we can sort of think of to try to help parents to be able to access the evaluations because they are very expensive. And we're happy to work with schools. We're happy to give you, super bill to send to your insurance if you have insurance. It's not Blue Cross or United Behavioral Health. Um, so let's check the time here. Um, So we want to make sure that the reports are written in a way that they're comprehensible and meaningful to non-psychologists, not filled with jargon, and that the findings are put in the sort of historical context. Um, Sometimes I see really short reports that just sort of say, I'm the neuropsychologist and this is what I think without including all the test data and the observations, and that is not a good quality report. Diagnoses, if there are, should be stated clearly and substantiated. What is your evidence that this child has ADHD? Not just, I have Ph.D. after my name and I think they have ADD, ADHD. Um, a statement of what the risks are that are associated with the profile so that the parent knows if we don't provide treatment, where is this likely to go? And a really important thing is sort of a treatment plan versus generic recommendations. And one way to tell that right away is that if there's 5 pages of recommendations, they're probably generic recommendations that literally you could Google, how to help a kid with ADHD, and you would get these 5 pages. A treatment plan is something that's well thought out about, What type of treatment do they need? Who's going to do it? How frequent is it going to be? Not just therapy, right? There's millions of types of psychotherapy. What type of psychotherapy? What is the psychotherapy treating? What is the goal? All of that. That's a treatment plan, not generic recommendations. Recommendations that correspond to the current program. We see a lot of kids in private school, and if you write recommendations that are public school oriented for private school, it's not going to work because a private school doesn't have a speech language pathologist there who's going to provide speech language therapy or ABA or something like that. And for many kids who have significant disabilities, are they thinking about post-secondary transition planning? What happens after you get out of the cradle of the IEP? Um, so once we have all the testing data where the impression integrates all of that information, and it may or may not result in a diagnosis. And this is another important misconception is that people think you get tested and then they tell you if you have ADD. You get tested, they tell you if you have autism. Our goal is that we test you to tell you what we found about your child's strengths and weaknesses, and if there is a diagnosis that fits, obviously we'll tell you that. One of the things that's really important in a neuropsych evaluation, and I don't see it in a lot of other reports, is really thinking about what are the risks for this child moving forward. So, like, I'm working with a family right now who their child is basically having school refusal. And this is the second time in a year that the child has just stopped going to school. And so, I've been explaining to the parents, the risks for this child are that his world will just keep closing in more and more, that he'll go from not going to school to not leaving the house to not leaving his bedroom. And so the risk of not doing anything is that the anxiety is going to increase. It's going to get harder and harder to treat. Um, and the risk, for example, for a child with a verbal communication issue is that they're at risk for difficulty learning how to read when reading demands come into play. And so I think sort of giving this roadmap of here's where we are now, and here's what the risks are ahead based on what we know about the child's profile. And then the recommendation section is how can the child be supported or accommodated at home and at school? And how should the child be taught compensatory skills? So if the child has a learning disability, how do we teach them how to read, knowing that they're going to need a different mode of instruction? Um, I found that strengths-based recommendations can be particularly helpful. So, for example, if you have a kid who doesn't have the executive functioning skills to clean their room, and they're a visual learner, giving them a photograph of a clean room and saying this is what it should look like so they can match it will be really helpful for their learning style. If they're more of a verbal learner, then giving them a sequential step by step. First, put all the dirty clothes in the hamper. Second, bring all the dishes to the kitchen. Third, so orienting orienting interventions toward the learning style can be very helpful. And then recommendations need to be prioritized with the parents at the feedback. And so it doesn't help to get 17 recommendations and feel like I don't even know where to start. I don't know how to do this. This is a lot of money, right? The neuropsychologist should say the first most important thing that we need to do is this. And this is where we need to put all of our resource. And then once you've got this wheel turning and everything is going okay, touch base with me in 3 months and we can sort of work on the next one. But parents need to understand where you're going to get the most bang for your buck in these recommendations. Recommendations need to be specific and backed up by information from the testing. And this is really critical if you're going to end up having to fight with the school to get some kind of service. You need things to be laid out with, a good amount of detail. Um, the evaluator should do a classroom. Whoops, sorry about that. The evaluator should do a classroom observation if necessary to make school-based recommendations. Sometimes as an evaluator, it's clear to me what the child needs, but I'm not quite sure how it's going to be implemented within that child's school. Like, let's say they go to a parochial school, and I don't know what resources are available there. And so often I will say to parents, I can either give you sort of general recommendations and we can see what the school does with it, or I can go into the school and talk to the teacher about how does reading happen? What do you do with kids who need more intervention? How does this work? And really work with them so that I'm writing specific recommendations for this particular school, or that I'm able to tell you, I'm not sure that the school is going to be appropriate for your child. I'm not sure they're going to be able to provide the support that your child needs. Um, and overall, that the evaluator should assist with the implementation of recommendations, to steer you in the right direction to the right therapist, to help you think about if this is the right school, and so on. Um, yeah, so I'm going to stop there. And like I said, we can make this available to everyone. And we have about 10 minutes if there are questions. Let me just pull up the Q&A. Um, let's see. Has Boston Public Schools paid you before for an independent evaluation? Yes, they have. We have seen many kids from Boston Public Schools. Um, let's see, I think these were all answered. Um, other questions? All right, I don't think, yeah, I'm not seeing any other questions. So we will stop there, and I will ask Jane to email the handout to you so you have the information if it can be helpful for you. And I hope that this answered some of your questions about a neuropsych evaluation and that you're able to move forward. Thank you so much for joining us this evening.